let's start. Well, first, sorry for the delay. You all know Dubai is a nightmare in terms of traffic, and we're expecting people to come. The good news is that there will be a recording of the event, so doctors who couldn't be here tonight can view the recording later on YouTube, and we will share the video with you as well. Yeah. So we would like to thank you all for being with us, and we will have a short intro first. My name is Anne, and I'm in charge of marketing for Clartéis. It's very nice to meet you all tonight. And we have Professor Majid Elsheikh with us tonight. We were supposed also to have Dr. Ayam Kanu from Oman, but unfortunately he had a very last-minute family matter to attend to, and he couldn't be with us tonight. So I will be sharing his personal insight on Xiplex and his results on his behalf. And then we will follow with Q&A, and I'm sure Professor Majid will be very delighted to answer all your questions. So who we are, we were founded in 2014 by Laurent Meillac, who is here with us today, our CEO. In 2016, we launched Xiplex, we had the CE mark, and we were also ISO certified. And in 2017, we got FDA clearance. Today, we are present in more than 49 countries globally, and we have already got over 800 devices on the market. Talking a little bit more about Xiplex. So we have a device here if you want to have a look at it later. So as you all know, Xiplex is a monochromatic excimer light that treats autoimmune skin conditions at a wavelength of 308 nanometers. Our strength is obviously the power output density, where we have 100 milliwatt per square centimeter, and our spot size, which is very, very large, 5 by 5 square centimeter, which allows for very, very fast treatment. Our total optical power is 2,500, and the weight is amazing. It's only 950 grams, which makes it very easy and convenient to use, and very light, both for the doctor, obviously, the physician, and for the patient. It's very comfortable. We have clinical proven efficacy, so we have 2 clinical studies on Xiplex, one which is on segmental vitiligo, and one on very resistant cases of alopecia areata. And we also have one white paper. Overall, there are over 200 clinical studies published showing that 308 nanometer is the best wavelength to treat autoimmune skin conditions such as vitiligo, psoriasis, and alopecia areata. In terms of conditions, we have the CE mark for vitiligo, psoriasis, alopecia areata, mycosis, fungoides, and atopic dermatitis. And we have FDA clearance for vitiligo, psoriasis, atopic dermatitis, and leukoderma. So basically, we believe that Xiplex is a unique solution for all doctors to treat alopecia areata, psoriasis, and atopic dermatitis, as well as vitiligo. The acquisition cost is quite low, and there are absolutely no consumables, as it's not a laser, but it's a light. So it provides with a very fast and high return on investment. It's very time efficient because, as we said, we have a very large spot size, so we can treat the patient in a very short period of time. It's very comfortable, both for the doctor and for the patient. It's a portable device, so for doctors who have multiple clinics, they can bring it from one clinic to the other. It's very convenient and can always be on the go. It's very user-friendly. The interface is very intuitive, which can be used by doctors or nurses, and it's a new service for any clinics to have. So as we said, today with us we have Professor Majid Elsheikh, who is the owner of STARS Laser Clinic for dermatology and venereology and aesthetic medicine. He's the president of Derma Planet Society, and he's held 2 international conferences, both in Cairo and in Luxor. And Professor Majid will now come and present to you his review on excimer light. Okay. Thank you very much, Professor.
Thank you very much. Assalamu alaikum. I'm so happy to be with you today. Today I'm going to tell you about this very nice, important machine, excimer light, and not laser. It's a reduction tips. I can't imagine a dermatology without excimer light in his clinic. It do a lot of things. It's very important for all skin problems, not only for vitiligo, psoriasis, mycosis, fungoides, but also for androgenetic alopecia, for telogen effluvium, for Psoriasis alba, for tinea versicolor. It's very, very important, very nice, and very helpful machine. Excimer light is used to deliver targeted phototherapy. What's the meaning of targeted phototherapy? And what's the difference between excimer and other phototherapy, as BUVA, narrowband UVB, UVB, UVA? What's the difference? When we are dealing with excimer, you are dealing with the skin lesion itself. But when we are dealing with narrowband UVB, we are dealing with the skin lesion and with the normal skin. So, which is the better? The better to deal with the lesion, with the diseased area, as we use in excimer light or excimer laser. Today, we have this very nice Xiplex excimer light, used to deliver targeted phototherapy, also known as concentrated phototherapy or focused phototherapy, to treat the diseased area only. The main advantage of this targeted phototherapy is safety and ease of administration, suitability. It's easy to reach a very difficult area to be treated. Can you see the Xiplex? The spot size is very large, 5 × 5. It's very large spot size. So, what's the main indication for usage of Xiplex? Vitiligo. I believe that vitiligo will never heal without phototherapy. حد عنده اعتراض؟ Any objection? Vitiligo needs phototherapy. Without phototherapy, you are telling lies. Sure. The second, psoriasis. It helps. Active atopic dermatitis. It helps. Alopecia areata is very important. Mycosis fungoides is one of the most important maneuver to treating and controlling mycosis fungoides. Psoriasis alba, resistant Psoriasis alba. So the main indication for this Xiplex is vitiligo. It's a powerful medical device that must always be used under responsibility of a doctor or well-trained assistant or nurse. It's a very important item to be known by doctors, only by doctors. It's very difficult to understand this pathogenesis, but let me try. I'd like to ask you about what's happened in psoriasis and malignancy as mycosis fungoides. Hail. Look at my hand. It's a basal cell of the epidermis. It's a basal cell. Normally, normal mitosis occur in the basal cell, dividing the basal cell in two identical cells. One stay in its place, and the other move on. Okay? This division is called mitosis. One will stay at base, the other goes upward. This upward movement is called epidermal turnover time. Okay? Normally, the mitosis occurs in about 12 to 19 days. And this journey will take about 28 days. It's normally. Repeat. The mitosis occurs normally in 12 to 19 days, normally. And this journey, epidermal turnover, spend this journey in about 28 days, okay? What happened in psoriasis? What happened in psoriasis? Look at my hand. Very rapid mitosis, very rapid epidermal turnover. So we have abnormal mitosis, abnormal. So I'm always tell my student that psoriasis is a benign disease wearing a coat of malignancy. And there is abnormal mitosis. There is abnormal mitosis, but it thrown its cells to the outside. In malignancy, there's also abnormal mitosis, targeting the abnormal cell toward the blood vessels and lymphatic. Look at my hand. What is this? What is disease? We are talking about psoriasis with abnormal mitosis. But what about this disease? It's a malignancy, Mycosis fungoides, abnormal mitosis, targeting blood vessels and lymphatic. So, always in psoriasis and in Mycosis fungoides, I'm searching for a machine or maneuver or a drug that has an antimitotic character, okay? Does this Xiplex has this antimitotic character? Sure. How? Look at it. First, the radiation is absorbed by endogenous chromophore. So, the radiation does not enter inside the cell. The radiation is absorbed by the DNA in the cell. The most important chromophore is DNA. Okay? Okay? Right. UVB, as in Xiplex, 308, exposure, reduce DNA synthesis, which is the most important cause for this abnormal mitosis. So, the Xiplex, the excimer laser, the first mechanism is antimitotic function. The first and foremost, how does Xiplex act? By antimitotic. The next, so we can use Xiplex in treating only by this psoriasis, and in this condition, Mycosis fungoides, and it acts as an antimitotic pattern. It means it induces the expression of tumor suppressor gene P53, and this leads to cell cycle arrest. Tumor suppressor gene, what's its location? It's the gene, the chromosome, is the nucleus of the abnormal mitotic cell. So, when I use this Xiplex, it will induce the tumor suppressor gene, okay? Tumor suppressor gene. So, it will suppress the tumor action, the mitotic action. So, it will have an antimitotic action by suppression or stimulation of this tumor suppressor gene. The second, okay? The third, induce the release of interleukin 6 and 10. What's interleukin 6 and 10? Which play important role in immune suppression. The third, it induces the induction of interleukin 6 and 10 immune suppressive. So this Xiplex, this excimer light has an immunosuppressive action. Okay, The fourth has a strong effect on Langerhans cell. What's Langerhans cell? What's Langerhans cells? Antigen presenting cell. Play. Very loud sound. Antigen presenting cell. That play important role in developing atopic dermatitis and eczema. It cut the dendrites of this antigen presenting cell, preventing its antigen presenting capacity. So we can use this Xiplex, this enzyme light, in treating eczema and atopic dermatitis. الساحق الماحق الذي لا يصد ولا يرد. The most important function for using this machine is the stimulation of melanocyte synthesis and the melanocyte activity. From where I can promote a new melanocyte. I have a vitiligo lesion now. Silly. I have a vitiligo lesion. From where I can promote a melanocyte. Only from the hair follicle. Only from the hair follicle. Okay? Okay? And from the neighboring normal area. We call it vertical repigmentation and horizontal repigmentation. Without phototherapy, you will never gain a result. Without phototherapy, we will never treat a patient with vitiligo. حد عنده اعتراض؟ It has a very nice effect, but you have to avoid the possible side effect as erythema, which may last for more than 3 days, blister while walking now, inducing blister by Xiplex. But I will never mention what I'm doing now. Temporary hyperpigmentation. Lastly, transient hyperpigmentation. This is the only side effect. No side effect as like those in using narrowband UVB as malignancy, never. Why? After 10 sessions or 15 sessions if you never take a result, you have to stop. You will never take a result. And it's possible. What's the minimal erythema dose? What's the minimal erythema dose? The dose we are searching for. It's the dose we are searching for treating different skin conditions. It's ultraviolet dose over which the patient will get an erythema after exposure. At test spots over the minimal erythema dose shall result in transient hyperpigmentation. It's recommended to perform the test on hidden part of the body. 6 different exposure areas done where a homogeneous erythema is created within 24 to 48 hours after exposure. Can you get it? We have to decide the minimal erythema dose to start our therapy. Except in vitiligo. I'll never using this minimal or never searching for minimal erythema dose in vitiligo. In vitiligo, we are starting from the lowest dose. Okay? But in psoriasis, in mycosis fungoides, in atopic dermatitis, we have to start or to detect or to select or to determine the minimal erythema dose to starting our job. Treatment dose. The first session should always be performed with affluence below the minimal erythema dose. Can you get it? I will try to explain. Are you afraid? It's my machine since 7 years. No. This is the reduction tips. We are using this small spot. Okay? And we select how to decide the minimal erythema dose. In a healthy area, in a covered healthy area, we start to choose 6 points. As. 0.2, 0.3, 0.4, 0.5, 0.6, 0.8. Okay, you get it? And the patient come again after 24 hours. And see which of the doses which makes erythema. How many spots? Okay. If no erythema occur, you have to reply again, and you do another 6. 0.9, 1, 1.1, 1.2, 1.3, 1.4. Okay? And you tell him to come tomorrow and see. 0.8, if 0.8, 0.9, doing nothing. But 1, making the erythema. 1.1, making erythema. 1.2, more erythema. 1.3, more erythema. So the minimal erythema dose will be 1. You have to start. You get it? So the first session should always be performed with affluence below the minimal erythema dose. Suppose it's 1, so I will start with 0.8. The safety, it's my protocol, to start with 70% from the minimal erythema dose in psoriasis and mycosis fungoides. Okay? But with the following doses, we are using very high doses. Okay? 3, triple the dose. The treatment is well tolerated by patient. The dose shall be increased session after session. Okay? Okay? The first session only will be under the minimal erythema dose. After that, use the triple or the double. Okay? As we are dealing with a focal disease, it's a focused phototherapy, localized phototherapy. Don't be afraid. But the first session should be, the first dose should be performed at affluence below the minimal erythema dose. You get it? Since the ultraviolet B can induce burn or unwanted hyperpigmentation, it's recommended to slowly increase the fluence between 2 sessions. Treatment protocol. In psoriasis, can you see this machine? What it is? Yes. Okay, we are dealing with Xiplex, with the diseased area only. Okay, the first session only, I'm going to use a low dose. After that, look at it. In psoriasis, batches, initial dose, twice the minimal erythema dose. Suppose the minimal erythema dose was 1, so you will start with 2. Top. See the result? Post-treatment erythema. Okay? خلي بالك معايا. Post-treatment erythema, no erythema, first 24 hours, the previous dose plus 0.5 times minimal erythema dose. You get it? And go on. If the erythema lasts for less than 72 hours, 3 days, previous dose, but you have to lower the dose. Okay? But if the erythema maintained for more than 3 days, you have to stop for a week. Look at it. Example of dose calculation. If the minimal erythema dose was 250 millijoule per cubic centimeter, minimal erythema dose is always a fixed number. Can you remember how to determine the minimal erythema dose? Okay? Okay. If no erythema occur, the first session, twice the dose of minimal erythema dose. Okay? Locally, the diseased area type. The second session, 2.5 multiply in the minimal erythema dose. If no erythema, you go on increasing the dose. 3 multiplying it to 5 millijoule, 750 millijoule per cubic centimeter, and go on. When you are going to stop session after session, you have to increase the dose. When you are going to stop, if erythema occur,
until the patient is unable to take a higher dose.
Sure. What is complaining from?
Erythema,
Erythema, pain, bullous eruption, stop. You are going to recur again. Stop for a week. It's my protocol. Stop for a week and recur. But what's the dose you are going to recur on? 70% from the highest dose. 70%. Suppose it was 3 joule. 2.1 joule. And you have to increase gradually. You get it? Look at this very nice case. Only 6 psoriasis batch must be treated with triple the dose of minimal erythema dose. You get it? Triple the dose. Suppose then minimal erythema dose was 1. In plaque psoriasis, you have to start with triple the dose. Psoriasis treatment can go on up to 15 sessions and must be performed twice per week. Okay? Before and after 8 treatment sessions, before and after 5 sessions. But what about vitiligo? ايه رايكم؟ What about vitiligo? هل نستخدم مينيمال ايريثيما دوز؟ Are we going to? Never! But what the protocol? It's here. The protocol is here. Okay? Periocular and genital area start with 15. يعني ايه؟ Look at me here. Okay, this is 50. Okay, start. Don't look. You can hear? Okay. Periocular or genital area, start with 50. Face and neck, 100. I'm touching the machine with your skin. It's a focused phototherapy, okay? And now go on. Arm, leg, trunk, 200. Elbow and knee, it's a very resistant area, but it gives a very nice result, 300. What about hand and feet? depressive area, 350. What about finger and toes? 400 or more. Go on. Okay.
Does Fitzpatrick matter here?
Ah, okay. As you dealing with vitiligo, forget Fitzpatrick.
Because it's all white.
All white. You are dealing with type 1 or type 0 Fitzpatrick. You have no melanocyte here, okay? Take care from the normal pigmented area. You have to be away from the normal area, okay? To avoid hyperpigmentation and increase gradually session after session. And now you will see our case is very helpful and very effective in treating vitiligo, okay? Post-treatment erythema. After every session, you have to decide, does the erythema have to occur or never? هيحصل erythema ولا لا؟
It's important.
It's a must. But after what, how many sessions? I don't know. 1, 6, 7, 10. No, I don't know. I'm going on. As there is no erythema, increase the dose by 50 millijoule per cubic millimeter. يعني 50 تبقى 100, 150, 200, 250. Okay, go on. استمر. Once erythema occur, you have to stop for 3 or 7 days. And start with a dose 70% from actually I am increasing from 10 to 50. I am increasing from 10 to 50. As periocular and genital area, just 10 every session. But what about the elbow and knee finger? Oh, go on. Okay? But I'm always like the protocol. هنا خلي بالك session frequency up to 3 times per week. It's better to use it 3 times per week. Okay? Vitiligo treatment 20 to 13 sessions, it's more than enough. You can see our result. This before and after just كم session يا غدا؟ تقريبا 10 sessions. Before and after, not more than 10 sessions. Okay? Together with topical calcineurin inhibitor, Taramas, Elidel in the face, just Elidel working in the face. Topical calcineurin inhibitor or topical steroid elsewhere. Okay? Oh, it's magic in alopecia areata, particularly in children. What about injecting steroid in the scalp of a children? Sure. Forget the atrophy and other complications. What about the psycho condition of the patient? The crying. Okay. But what about using a phototherapy in alopecia areata with very, very, very nice effect? Our patients, our children love this machine. Oh, I'm going to my doctor, to my lovely doctor. Okay, now he is going to put the machine on my no injection. Okay, but what about the results? Very effective, very nice. Not more than 10 sessions, and believe them. تحفة. Okay, very, 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 very nice effect with alopecia areata, as you see. Atopic dermatitis. Torshireen is my assistant. She's my assistant, one of the most powerful doctor. Once I tell her, we have to treat this patient with atopic dermatitis, Shireen. Active atopic dermatitis, irritant atopic dermatitis, and give her a phototherapy. You have to burn it. Shireen, we are dealing with immunity. This machine it's not a cigarette. This machine, this machine is an immunosuppressive maneuver. It's a locally immunosuppressive tool. It will never hurt your patient at all. After the second,
Actually, it was one session.
one session,
One session.
tell me what happened to your patient with atopic dermatitis. Oh, it's very effective. I can't imagine. I can't imagine. She thought that phototherapy will make the disease more worse. No, we are talking about a medicine, immunosuppressive tool. Sure, after that, you are using it a lot in your patient with atopic dermatitis. شبح الاتوبيك dermatitis. ماشي. هنا انا مبوظ البروتوكول خالص. بوظ البروتوكول outside your protocol completely. Do you know what's Mycosis fungoides? Can you remember this? It's psoriasis. But what's this? Mycosis fungoides, skin cancer. Skin cancer. Skin cancer. Here, I may use this machine with a higher joules, with more frequent application per week, more than 4 to 5 per week. The only in Mycosis fungoides. 2 times per week, as your protocol say. But my protocol say in Mycosis fungoides is very effective. And I cannot imagine any doctor treating skin cancer with methotrexate, with higher dose, without phototherapy. It will never heal. So we have a combined therapy, immunosuppressive, either oral or injectable methotrexate, together with phototherapy with a very higher dose. The effect is very, very, very nice, and you can see the case here. Mycosis fungoides before and mycosis fungoides after with systemic methotrexate and topical Xiplex. I want to laugh. سقف نفسي. سقف نفسي. Contraindication. Skin dermatosis with Kubner phenomena. Kubnerization means isomorphic pathological lesion in patient with skin pathology on top of scar or scratch mark or burn. Kubner's phenomena, isomorphic pathological lesion in patient with skin disease on top of scar or scratch mark or burn. Vitiligo, one of the most important disease with Kubner phenomena. How to deal? This means that you will never use excimer light with vitiligo. صح? No! You have to use it, but you have to avoid reaching even the minimal erythema dose. Okay? So, patient. How will you know that this patient have a Kubnerization with vitiligo? Any scar, any old scar, like a mastectomy, if you can find a lesion like vitiligo in a patient with vitiligo, so he has a most of Kubner from. Avoid using this machine with a higher joules. Avoid reaching even the erythema. Okay? So if the patient his lesion will heal after 15 sessions, no, I don't need after session. I need him to heal after 30 sessions. Okay? No problems, but you have to avoid this patient a higher dose. Lupus erythematosus, patient using pacemaker, hyperthyroidism, photosensitivity, Melanomas, you have to avoid using. Drug with photosensitizer as a patient using Sorolin, don't use. Radiotherapy, pregnancy, periocular vitiligo. You can see the improvement in less than 15 sessions. Okay. Vitelliginous lesion in a patient with vitiligo before and after 12 sessions. Axillary lesion before and after 5 sessions. This young man was called Muhammad. He's one of the 60 years old, was suffering from alopecia universalis. He takes systemic steroid with no result. I gave him cyclosporin in a low dose, 50 milligram per day for 4 weeks with no result. I continue cyclosporin together with phototherapy Xiplex just for not more than 6 weeks. This was the result. Vitiligo, before and after, 6 sessions only. I think this patient is completely cured.
Yes,
I think,
completely cured.
yes. This patient was burned, burn-induced vitiligo. Okay, you can see the fractional laser dealing with the burned scar, and here the vitelliginous lesion with Xiplex, just 6 sessions. Before and after, معكوسة دي. Before and after 5 sessions. It's a very difficult area. It's a very, very difficult mucosal vitiligo. Improvement occurred after 23 sessions. It's very easy area. Before and after 15 sessions, after just 10 sessions, 8 sessions, very difficult area to be controlled after 15 sessions, before and after, very nice result. You can see something happened here. Can anybody detect some amazing result? Oh, yes. The mustache hair become black. How? Who will take $100 and tell me? أيوة. She's my wife. You know all my secrets. $100 in Egypt إن شاء الله. تكون نسيت. اللي بالك معايا بقى. Now I am Magid Sheikh using topical minoxidil together with systemic Bentugar. Do you know Bentugar? No. It's a German drug. In German, it's called Bentuvigar. This drug contains what's called para-amino benzoic acid. It's used for hair regrowth, okay? And treating premature graying of hair. Premature graying of hair. I'm starting using those drugs, topical minoxidil and systemic parabenzoic amino acid for treating vitiligo. Together with the routine prescription for vitiligo. Okay, it gives a very nice result. As you can see, a repigmentation of the hair. Always you have to think from where I can gain the color to treating vitiliginous lesion? From the hair. So when you are facing a blackish hair in the vitiliginous lesion, you have to be happy. But what about a whitish hair on a vitiliginous lesion? Oh, depressive case. So you have to work. You have to work to regain the pigmentation of the hair. And it's very difficult. I think I reached the end of my lecture, and thank you very much. Any question?
What's the highest dose, Prof, do you reach with Xiplex? Up to how much? 1,000.
I will tell you my secrets. Dr. Ahmed, 2 years before, tell me, it's better to use or to divide the dose per session. يعني ايه؟ قال لي try some of our colleague instead of using 900 millijoule, he used 300 by 300 by 300. Do you know? يعني بدل ما اتكلم على 9,900 لا 300 and we put it. This is the first pulse. This is the second pulse. This is the third one. It may give a better result. I tried it. It worked. It worked. Very effective. In mycosis fungoides, I reached very higher doses. But after I'm dividing the dose, I see better result with less side effect.
Safety around the eyes.
Very safe. And you have to, أي child open his face على قفاه. Okay. Any other question? How much?
I have another set of examiner laser, Chinese one. But the power is 0.35.
Yes.
The exciplex is
Xiplex?
is time.
I think-
This machine is a time consuming. When
I-
I reach similar to 500, I catch the machine for about 17 seconds or 20
Oh.
seconds for one area. Okay, but in exciplex, 5 seconds enough.
Is the Rolls Rise?
For large
Is the
areas,
Rolls Rise
yes.
in excimer light? This is the Rolls Rise. Okay. Okay. Others. It's the best machine in my clinic.
What's the efficacy?
It's يعني regarding a money wise, it's a money maker. Sure. As regarding money wise, it changed my life.
You said, bro, that it is suitable for androgenic alopecia.
Oh, very effective in androgenic alopecia and intelligent improvement also. And the mechanism elongate anagen phase, reduce telogen phase, بيعمل induction لنيو angiogenesis blood vessels together with minoxidil or caffeine is very effective. Very effective. أنا جوعت بقى.
أنا كمان.
Any other question?
Thank you very much, Professor.
you.
Thank you all. We were going to follow with Dr. Ayam's before and after, but since it's already quite late, and I'm sure you're all very hungry from from the day, and since we've had
Particularly,
I'm sure.
your professor.
And really, I wasn't going to perform as well as you did. Yeah, really, thank you for such an amazing presentation and for your time, and thank you all for coming this evening. So we will come out and go to the left, where we will have a dinner buffet all together, and follow through with our evening and probably more questions for Professor Majid. Thank you all. Have a great evening.
Thank you very much.